Hello, my name is Jennifer Shelton. I'm a registered nurse and a Bluefield State nursing student. And today I would like to discuss how to properly teach a patient to check and monitor their blood glucose levels. Who should be taught to check their blood glucose levels? Anyone who's a diabetic, type 1 or type 2, anybody who has gestational diabetes or is at risk for any type of diabetes, anyone who's already diagnosed with diabetes, who may be uncontrolled, who may have questions, or who may not have been taught how to properly check their blood sugar when they were first diagnosed. Any patients who are taking medicines that may affect their blood sugar, such as patients with COPD who may be taking steroids, and any patients' family members or caregivers of any of the above mentioned patients. Why is it important for someone to learn how to properly monitor their blood sugar? It's important to help them control their blood glucose levels. It also helps with compliance. If a patient doesn't know how to check their blood sugar, they're not going to monitor it at home. And it also makes sure that they're receiving accurate results. Some of the equipment that would be needed would be a glucometer, test strips, lancets or lancing device. You would want access to soap and water for the patient to wash their hands, and if this is not available, an alcohol prep pad would work. Band-aids, and then if someone other than the patient is checking a blood sugar, such as a nurse or a caregiver, gloves would be needed. Now I'm going to show a patient how to properly check their own blood sugar. First, you would want to clean your finger. We'll use this alcohol prep pad. You'd want to make sure that you turn on your glucometer. Sometimes glucometers turn on when you insert the test strip. It's best if you can use the patient's own glucometer so that they're familiar with their own equipment. We're going to choose the spot, which is this finger we've already cleaned. It's best to use the side of the finger instead of the top. It's less painful. And you'd want to, at home, use each different finger so you're not using the same finger more than once, because it does become painful after a while. If you turn and twist, this piece comes out, and then you're ready to stick your finger. We're going to hold this against your finger and push down on the blue button. You may have to squeeze to get a drop of blood. Hold the test strip up against the drop of blood, and we'll wait for the results. Once you have your results, you would put your blood glucose reading on a log. Okay. You'd want to properly discard your lancet in a sharps container. If you don't have one at home, you can use a plastic bottle, but because this has a needle, you don't want to throw it directly in the trash can. Make sure that even though you've shown the patient how to check their own blood sugar, that you provide them with some kind of written instructions. Make sure that they have their glucometer user manual and that you give them step-by-step instructions, and it's best if it has pictures or images. It's also good to provide the patient with internet links specifically to the website for the manufacturer of their glucometer. A lot of times it contains step-by-step video. The patient may also ask, how frequently should I check my blood sugar? What time of the day? What should I do if my blood sugar is too high, too low, or what should my blood sugar reading be? How do I keep a log and what do I do with it? And what do I do if my glucometer doesn't work or shows an error? Make sure that you have the answers for the patient, and you should know, based on their health record, how many times, what their sugar should be. That way you can answer these frequently asked questions. After you've given a patient an explanation and demonstration, Ask the patient questions to check for understanding. See if they can explain the steps from first to last. Have the patient give a return demonstration to you and provide feedback and reteach any steps that are needed. Thank you.